everybody, we're back. The time is 9:10. There is a concern right now in Minnesota hospitals and many around the country. Apparently, some patients are staying too long.
Yeah, according to the Minnesota Hospital Association, these are called discharge delays. And every day, more than 400 people are in an acute care hospital bed when they don't really need to be.
Our KSTP medical expert, Dr. Arkel Giorgio, is here to share why this is happening and what you might be able to do about it if you find yourself in this situation. Doctor, thanks for joining us today.
Thanks for having me.
I will admit this is something I did not know was happening, so explain.
Yeah, so usually we worry about being discharged too early, but being discharged too late is the problem right now, and it's causing a crisis. So discharge delays is when patients are medically cleared to be discharged, but there's no place to send them that would be safe. And so they sit in that hospital bed, not needing acute care services, sort of in limbo.
So this is something like when I was reading about this segment, I was thinking of my grandmother who suffered a stroke. She was in the hospital. She wasn't strong enough and able enough to go home, but there was no home that was available to take her, no rehabilitation facility. Is that kind of what you're talking about here?
Well, that's one of the root cause reasons. So there's many different possible root causes, but there's two categories that really float to the top and probably create more than 75% of the reasons for discharge delay. One is that patients need to be transferred to another facility. They don't need acute care, but they may need skilled nursing, they may need rehab, they may need mental health, and there are no beds available. So they can't be discharged home because that wouldn't be safe. The second reason is that there may be a bed available, but it takes coordination on the part of the hospital to make that happen. So, for example, the receiving hospital needs to know what are the physical therapy needs, what are the speech therapy needs, what is the condition of this patient. Then they have to copy medical records or transfer them electronically. They need to arrange transport. That can take days. So, two root causes: lack of beds and hospital coordination services.
Are there not staff to be able to do that?
They're really short-staffed.
They're so short, yeah.
And all of those pieces need to intersect so that transport needs to be available when the other facility has that bed available. So lots of coordination needs to happen.
So as a family member of someone who may be hospitalized, is there anything you can do? Because it can feel very helpless if you're being told, yes, they can be discharged, but we have nowhere to put them. How can you, as a family member, help out in all of this?
Well, the first thing is to not think that you're helpless and to really take charge. And I've done this personally with my mom, who's been hospitalized many times. The first thing that I would recommend is that on the day of admission, or maybe the day after, begin to say, I know they may be in the hospital for 2 days, 5 days, maybe 2 weeks. Let's start thinking about discharge now. And you may need to really push on that conversation and then ask for a social worker consult. It's not, social workers in hospitals are the people that begin to arrange all of those services and figure out what that patient's going to need. Get on their list of patients to round on early. So get a social worker consult early. And then if your loved one is going to need transfer to another facility, the social worker or the discharge planner is going to say, well, I'll go make some phone calls and get back to you on what's available. Do your own research. They have their facilities that they're comfortable transferring patients to, but there may be others in the area that have availability that they're not thinking about.
Smart.
And finally, if the individual is going to go home, be realistic about what someone's going to need when they go home. They may need a wheelchair, they may need a walker, they may need oxygen. Those things take a while to coordinate and get delivered to the home so that when the person does get discharged, they can be safe.
What is the danger of people staying in the hospital too long?
Oh my goodness. Well, it's gridlock across the entire system, and it affects the person that's waiting in the hospital bed, and it affects people who are waiting for a hospital
bed.
Absolutely. So for the individual that's in the hospital bed and in limbo, there's two key risks. One is that being in the hospital just sets you up for infection. Hospital-acquired infections are such a huge problem. The longer you're there, the higher your risk is. The second is that the longer you are less mobile, less active in a hospital bed, you become deconditioned, and so it increases your risk for a fall. So that's the risk to the patient who's waiting. Then, for those who are waiting for elective surgery, that could be delayed. For people who need to go to the ER and then get admitted to an acute care hospital, the ambulance the ambulance systems know when beds are available, they may have to divert that person to another location, and then hospital loses money. The whole system loses money, and it may cost the patient more money.
What else? What else do we need to know about this? I just keep thinking back to my grandmother. You know, she was able to be discharged from the hospital early, but she had nowhere to go. And you mentioned kind of not being mobile like that. By the time she finally got to the rehab facility, she had no muscle. She couldn't even do the therapy anymore. It was such a downhill for her from there that it was heartbreaking to see its family. It's so important.
It is so important. And you know, the other thing that it does is that the individual who's been in the hospital really wants to transition out. And so it also affects their mental health and their motivation to be active in physical therapy and rehabilitation therapy. And so, you know, the downstream effects are so hard. So that's why I go back to don't feel helpless, speak up, which I talk about a lot, and begin to take some charge about what is this discharge going to look like. You will face some resistance because the discharge planners are so busy. They only want to deal with the people who need to get out today. But speak up for yourself or your loved one so that you begin to coordinate early.
Has this always been a problem, or is this something that we're seeing that's new as far as not being able to put people where they need to be to have these delayed discharges? Has this always been an issue?
You know, I've been in the industry for a long time, and as the medical director of a large system, I've seen discharge delays for many, many years. But I think it's really hit a fever pitch right now. And one of the reasons is that there are so many mental health needs. And if you look at the types of beds that are not available, mental health beds are at the very top of the list. You know, we especially see it in mental health beds that children might need. Children have very special needs. And so it is especially difficult to meet their needs when you need to get them transferred.
And there's been a lot of discussion at the state level of trying to find a way to pay people more who are working in maybe some of these secondary facilities. So when somebody leaves the hospital and they go to rehabilitation center, they're having a hard time finding people to just work at these facilities.
Oh, the nursing shortage, the worker shortage is contributing to all of this. And yes, it was happening before, Megan, as you asked about earlier, but COVID really gave us a spike in all of this activity and how much of a stressor it is. And you know, the other thing that's happening in terms of stress is studies have shown that when you have this gridlock, these discharge delays that are causing such a problem, the impact on the nursing staff and the hospital staff in general is really huge because they have patients that are just sitting there and getting frustrated. They have patients that are sitting in the hallways from the ER needing to get into a bed. They're being pushed to try to do what they can, and it contributes to burnout on the hospital staff. And that's why I said earlier that it really, it hurts everyone all the way around when this is happening.
Yeah. It's an interesting topic and one that I don't think people think about until they're in it.
Well, we've heard so much about, well, your insurance company is going to get you discharged too early and you're going to go home before you're ready. That can be an issue. That's not the issue right now.
Yeah. Okay. Thank you, Arkell. Great advice for folks.
Thanks, doctor.
Perfect.
If you have questions about your health, make sure that you consult your doctor. Of course, Dr. Giorgio is the host of the Speak Up for Your Health podcast, and we posted a link to the episodes at minnesotalive.com.